Hello and welcome to another episode of the CIRS Group podcast. I'm JC,
And I'm Barbara.
and today we have a very special guest, Dr. Kate Berry. But before we get into the episode, just a reminder that none of this is medical advice. If you are looking to change anything up in your own protocol, definitely talk to your provider about it. And without further ado, Dr. Berry, would you like to introduce yourself?
Hi, everybody. My name's Kate Barry. I am from Sydney, Australia, and I am a functional nutritionist, a naturopathic practitioner. I also have a PhD in biology, and I see clients from all over the world. So please get in touch if you want to talk about CIRS.
Amazing. That's so exciting. And yeah, thank you again for taking the time to be here and to do
No
this with
problem.
us. Yeah, really appreciate it. I wanted to ask first how you got into the SIRS space specifically.
So kind of similar to many practitioners in this space, I think, unfortunately, it was through personal experience of CIRS. So I first had symptoms, I guess, that I recognize now in kind of 2015, 2016. Took me a good couple of years to figure out what the problem was after, as many people go through, seeing a multitude of doctors and specialists, finally realizing it was mold from my workplace was the main issue. And then, being diagnosed, going through treatment, which went pretty well initially. And then, unfortunately, even though I had kind of mostly recovered, I had this kind of chronic fatigue relapse, which then took another few years to get myself out of that hole. And, along the way, meant trying to get back to work full time with the fatigue issues, but also with the workplace being, a concern. Eventually, kind of realised that this is not going to be helpful for recovery, and so decided to retrain initially as a health coach, then as a functional nutritionist, and then from there I've kind of done various mold trainings, knowing that that's the space I really wanted to end up in, so I could help people that were, had suffered in the same or were suffering in the same way that I had suffered. And so, one of those trainings being Dr. Shoemaker's Proficiency Partners training. Yeah, so that's kind of how I got into the space. And, it's kind of a win-win, because not only do I get to help people through, a tough time, but I'm also much more in control of my own health because I can, I don't have to go into buildings that are going to cause issues for me, like
Yeah.
the initial workplace did. So yeah,
Well, thank you for sharing that. I think
it's
a
okay.
lot of our listeners will relate to that story of coming to this space through their own journeys, whether they're a practitioner or a patient. And I think a
Yes.
lot of us end up at this place where we pursue the Shoemaker Protocol because it's the only clinically proven path to healing from mold. But from our understanding, and especially from our international listeners, we understand that a lot of people have trouble accessing the entirety of the protocol just because some of the prescriptions aren't available in other countries, or it can be difficult to get the blood work. There aren't trained remediators, stuff like that. So, in kind of going through this, we know the most important steps of the Shoemaker Protocol are to get out of exposure, take binders, and repair with VIPs. So, how can those steps be adapted for people who don't have access to the gold standard of the protocol?
So, I mean, with that first, I guess I would also add another step in there. I think I agree that they're the three main kind of components, but I find some prep work in between getting out of exposure and doing binders to be really helpful as well, particularly if you don't have access to a doctor that can kind of easily prescribe things and do the testing. So I'll come to that in a second. But in terms of getting out of exposure, I think, it's pretty similar globally, right? This issue of being able to, first of all, recognize that there's a problem, but also easily get out of exposure and then find an appropriate place to move to, right? I think is the big problem.
Yeah.
The things that I see consistently that I think are fairly common, at least in Australia, and I think it would be similar in similar countries. Houses are going up very quickly because they're often investment properties, and so they're really just thrown up as quickly as possible. And obviously there are then problems because of the quality of the build is not great. So that's where you come into this, we think about old homes being mostly problematic, but actually new homes are also, I feel like in the middle there somewhere is the best. We're having problems with new homes because of that quality here as well. The fact that houses don't breathe is a big issue, trying to keep the heat in, trying to keep the cool in. These are all, I think, fairly global problems. In Australia in particular, the combination of humidity, especially along the coast, and rain is a big one. Just causes a lot of kind of increased humidity and, condensation issues, I guess, without even having water ingress. It's just this condensation. And then the cross-contamination, I think, is often, not spoken about as well. You don't know what the people before you in the home, what their furniture was like, where their previous home was. So you kind of come up, against all of these problems. And in terms of, in inspecting and sampling homes, like finding somewhere, I think you definitely need to do both. I think a big problem is people don't sample. They just, go and have a look at the house and think, oh, it looks good. It definitely can look good and not be good. I've experienced that myself in our current home. Looked perfect. We even did some sampling and it didn't look too bad. And I was sick as soon as I came into the house, and it took to really like demolish the whole bathroom and the front of the house to find the problem. So, it's a really common issue, I think, and people just don't. And also, I think, it's probably similar everywhere else too, in terms of the sampling. It's not perfect, right? The testing isn't perfect. Everybody thinks slightly differently of which sampling they should do and what's the gold standard. I tend to go with let's do a bit of everything just to cover our bases. Definitely kind of usually start with an ERMI test to judge, what's going on in the home before you even need to bring in a professional. And then if the ERMI, shows problems, then you can kind of bring in an IEP or a building biologist or someone that's kind of very familiar with this problem. So, I think there's not a huge difference in Australia as to getting out of exposure. I think the one thing compared especially to the US and maybe even Canada that we have that's a benefit, an advantage, is that we don't typically have basements. And so we typically build on concrete slabs. And that's an advantage, right? Because we're not, obviously, as soon as you get down into the dirt, you have potential problems. So that's one advantage, but the rest I think is pretty similar in terms of the getting out of exposure.
Got it. Well, that's good. So you do have access to ERMI testing there and
Yes.
is that through the company we're familiar with here in the States is EnviroBiomics. Do you have a lab that's there, or how do you any specific one to look out for if somebody's in your area, your neck of the woods?
So as far as I'm aware, there's only one. I did hear that there was a second lab recently, but I'm not familiar with what they're doing and where it's going and whatnot, so I can't comment. But the one that I'm aware of that's been going for decades is called NSJ Enviroscience, I think and that's run by David Lark, who has done a lot of research with Dr. Shoemaker.
Yeah.
And so he's been doing it for decades and decades. And so that's typically where we send, and he services the whole of Australia. So basically anybody can send in a dust sample. And unfortunately, it's got to go to the US, which is frustrating from a time perspective. And that's, I think, one of the big issues with renting is that you just don't have that kind of time, right? It's
No.
especially along the coast, in the populous kind of cities. You just don't have that kind of time to get testing back before, someone else just takes the rental, right? So
Right.
it's okay if you're buying, but it's not okay if you're renting. And that's one of the big problems, I think, where people just kind of go to a rental that looks good, but isn't actually okay. So, yeah.
That's unfortunate. So getting out of exposure does seem
Yes.
relatively similar, but with obviously a couple
Yes.
roadblocks and a couple,
Yes.
pros with the lack of basements and everything.
Yes.
What I know, this is kind of probably maybe the most controversial thing to ask about, but the binder aspect,
Yeah.
if cholestyramine and Welchol are not available, what options do you have?
Yeah, so I just want to also mention with the cholestyramine and Welchol, it's not always just about accessibility. It's also sometimes about tolerance.
Oh,
There are
sure.
some people that are super sensitive and are really, I would say, hepatically challenged,
Mhm.
and really just even tiny amounts. And it's more about, because it's so effective. It's nothing to do with the drug itself, but it's very effective. And so I think the issue is it pulls out so much toxin from tissues and cells that some people just cannot kind of cope with that, at least early on.
Sure.
Maybe they can kind of build up to that. So it's kind of a combination of those two things, the lack of access and the lack of tolerance. So for me, the ones that I try to, go by research, but also clinical experience, right? And what seems to work for people. And again, like you mentioned at the start, it's, we're doing this because there's no other option in some situations. So we're not looking for the same level of, standard, I guess. We're just trying to get some movement in symptom resolution, at the very least. So what I would, the ones that I guess there's research, evidence to show their effectiveness would be ground okra. So there's a few different products where you can get okra in ground form, in a supplement form. The study that I recall, I don't know when it was from, mentioned a 15% effectiveness as compared to cholestyramine. And that was a human study, so that's pretty good when you
Yeah.
consider that Welchol is 25% as effective as cholestyramine. So it's, even though 15% probably sounds not great, it is actually pretty good. The other ones, as far as I'm aware, the majority of studies on the other binders are mostly from livestock and not human studies, which is obviously not as good. But I find clinically that they do work, just not as in the same kind of ballpark as the prescription binders. So these would be things like activated charcoal, bentonite clay. There is a review study that was done in 2022 of lots of livestock through the food that the livestock are eating. But if we assume, and maybe it's a big assumption, but if we assume that it's at least cleaning up what's in the gut, then I think the numbers from that study was something like 80 something percent absorption capacity for the activated charcoal, and 60 something percent for the bentonite clay, for that same measurement. So they were reasonably, but there's no comparison to cholestyramine in this situation. It's more just what's the capacity for absorption. So I do find that they're effective, just not in the same way, like I said, and they take a lot longer to have the same effect, if ever. Maybe they don't even ever have the same resolution, but you do get some resolution, which again, like we're mentioning, is, if you have no other option, at least you're having some resolution of symptoms. That's a win in my book. So they would be the ones that I would typically be using, because they have, at least a little bit of research behind them. The other thing I would mention here, that because they're less effective, the timing and the pairing with other things becomes even more important than I think it is with the prescription binders. So timing the binders around food, pairing them with bile movers, bitters and things that are going to be, helping that bile move. So then the binders have something to bind to, pairing them with activities that will help to mobilize toxins, whether it's glutathione or sauna or coffee enemas or castor oil packs, whatever, lymphatic massage, whatever it is that, we know can help to mobilize. Doing those kind of combinations becomes much more important than it is with cholestyramine, because it's just super effective on its own. It's great if you can also do the timing then, but I don't think it's as important. Yeah, that's what I would say about binders.
So this is absolutely a trick question. VIP, it's the last step of the protocol, and it is notoriously difficult to access, not just outside of the US, but in the US, it can be hard to find a pharmacy. It can be difficult to travel with it. It has to be refrigerated. There are a lot of difficulties around VIP, but I imagine on an international scale, it's just so much more difficult. So how do you address that step of the protocol?
It's actually, I would say, the most difficult part, like you kind of alluded to in that question. It is available at some compounding pharmacies, but obviously there's only a kind of a handful of doctors that are, let's say, willing. I think everybody's able to, but most doctors don't even know that it exists. They don't really know what to write on the prescription, even if they were willing for the compounding. And it's really expensive. I've also had many clients who don't tolerate it well because of their liver issues or the lipase situation that happens. I personally had the lipase elevation that Dr. Shoemaker talks about, where you then kind of can't take it. I had to take it at a 1/100th of a dose or something like that to tolerate it. Some people don't tolerate it at all. So, it's a really difficult one because you don't have that same, well, not as far as I'm aware. Hopefully some stuff pops up in the future, but you don't have that same thing as you do with binders, where even though they're not as effective, there are alternatives. VIP kind of, I feel like it sits in its own little space. Yeah, it's a difficult one. I have been using a homeopathic tincture that a naturopathic doctor in the US has kind of created, just because it's homeopathic, and I thought it's well tolerated. There had been good results, so I thought I'll give it a try. I am actually having good results from a symptom perspective, but it's too early to know whether it's actually shifting the blood markers, right, or the brain scans, which is obviously the gold standard that you want to achieve, if at all possible. But again, I think if it's not possible and you have no other option, then symptom resolution is still a good result, right? So often what I'm finding is the mood issues will shift. People seem to have kind of less anxiety, more motivation, and that's really helpful for continued treatment, right, and getting through the rest of the protocol. So I'll be doing more testing like as we move through to see if it's actually shifting the blood levels or not. But that's kind of a watch this space. But otherwise, it's yeah, I'd love to to find some alternatives in that space. It is definitely the most difficult. Luckily, not everybody needs it. Like everybody needs binders, right? So at least it's only a portion of the CIRS population, but still a very necessary one in many cases.
That makes me think, do you guys have access to NueroQuant there in Australia?
We do.
Okay.
But there's only, as far as I'm aware, 3 hospitals that do it, 2
Wow.
on the East Coast, 1 on the West Coast. And again, it's kind of the same doctors that would typically prescribe VIP would be the same doctors that would be knowledgeable,
Right.
with NueroQuant and able to order it or whatnot. So it's there, but it's not often used. I guess it's not utilized as it could be and should be.
Right.
Same with the other
The
GENIE.
genie.
Yeah, that's even there's less access to that because the blood's got to go to the US. So that's even more problematic.
Yeah. There's like no way to keep
Yeah,
it frozen
that's
for
right.
that
Yeah,
long.
it's very difficult. Yeah, and expensive.
I'm sure. I mean,
Very difficult
gosh,
and expensive.
it's $200 US to send it just from my part of the country to Massachusetts, let alone I can't even imagine. Yeah, that's a whole,
Yes.
yeah, that's crazy.
Yeah.
So you mentioned that there's some prep work you do between getting out of exposure and starting the binders, and I think we're really interested in hearing more about that.
Yeah, look, actually, some you guys have mentioned a couple of these things on previous podcast episodes. So I'll just walk you through. It's basically it's something that people can do while they're trying to get out of exposure too. So I like it because people feel like they're doing something while they're kind of sorting out their home or work situation, which is often when you feel most vulnerable and like you can't you're not in control of anything, right? So doing something I think is helpful. And some of these things I should also mention, Dr. Shoemaker does talk about them, but usually as a only as a result of or in response to a problem with tolerance to binders to the cholestyramine. And I more use them in
Proactively.
preparation for the binders. Yes.
Mhm.
So I'd rather kind of prevent a reaction than wait for the reaction and see and then use it, if that makes sense. I think it's
Sure.
also just because I'm a health coach and nutritionist. So I find these things really helpful just in general health and wellness too, right? So diet is obviously a big one. I know you guys have spoken about the carnivore diet many times, and I don't always guide people to the carnivore specifically, but anything that's kind of whole foods, low carb, higher fat, higher protein is where we want to go. And I think everybody's different. Some people do so well on the carnivore diet. Some people don't do so well and they do better on a keto diet or maybe a low carb paleo diet or something like that. So, but some people have such significant resolution of symptoms just from changing their diet. And obviously, that's not necessarily changing, some of these CIRS markers, but from the perspective of symptom resolution, it's pretty amazing, right? Where just this seemingly simple change. And so that would be the first thing I would do. And in there, I would probably include the lipid replacement therapy as well, because I am often trying to push lipids in the diet as well. And then we may, fish oil or cod liver oil or something like that would be probably the first supplement that I would put people on. I know you guys have spoken about that and your success with that as well.
Yeah.
I find that to be fabulous in many different ways as an anti-inflammatory and as an immune modulator, all of those things. Lifestyle is another one. So the obvious things like sleep hygiene and making sure people are moving if they can tolerate any kind of movement, just to get that lymph moving, all of that stuff, right? The stagnation of sitting and not doing anything is just kind of compounding the issue with the toxins. Hydration is super important. CIRS patients are typically super dehydrated, even if they're drinking a lot of water. They just pee it out. And so,
Yep.
but at least making sure you're getting enough hydration is important. And then the nervous system component of it too, or, some people might call it stress management. I think it really depends on, there's a big spectrum here with CIRS patients of how much of this you need. Again, I know you guys have spoken about brain retraining in previous episodes. I think when people have been sick for a long time and had lots of kind of trauma around mold, the brain retraining programs are fabulous. And I've done them myself, when I was personally going through it, and found them to be very helpful. Some people, I think, just need more, techniques to help with calming the nervous system, breath work, meditation, tapping, whatever it is. I'm a big fan of the Wim Hof method, which also kind of gets toxins moving because of that, the temperature changes. Then I would move to gut health. So gut health being, I guess, two-pronged. One of the reasons is that it's just pivotal to overall health, but the other part of it is that it's pivotal to detox, right? And we're really trying to get to the point where we can optimize detox. And so working on, dysbiosis, which is very common, leaky gut, which is almost 100% of people with mold exposure, insufficient stomach acid, insufficient pancreatic enzymes. So you're not actually utilizing all of those amazing nutrients from the food that you're eating. Gut motility, super important for detox, right? When you're backed up, there's no toxins moving. And worst case, you're reabsorbing those toxins, which is really not what your poor liver needs, extra toxins. And then the detox pathways, which, some people would include that, I guess, alongside the binders, but I find it to be more helpful pre-binders. So just supporting that poor liver that's really bearing the brunt of this with food. I mean, I think sometimes we forget about food and how many foods are actually liver supportive and bile supportive as well, helping with the bile flow. That's one that I think is often missed. Is getting in those bitter herbs and those bitter foods, and also doing things like coffee enemas. I mean, you need to be careful at the start. I wouldn't suggest people at the start of their journey necessarily do coffee enemas, because they do dump a whole lot of toxin in the GI, and that can actually, be too much for the liver at the start. So I typically would do that kind of more towards the end, when someone's a bit more resilient and has already gotten rid of a bit of toxin from their system. But yeah, so they're kind of the steps that I would typically use prior to binders. One, because I think then the binders are better tolerated. But two, the person is just, I don't know, I feel like they get back a little bit of their resilience by doing those few prep steps, which probably contributes to that improved tolerance to binders.
Yeah, but it's great that, they could have access to you to guide them.
Whether it's a naturopath or a nutritionist or a health coach even that is trained in mold illness and has done some of these trainings, you really should have someone to guide you. But it just means that you're obviously able to access more people if you don't have. I've got a client currently in Saudi Arabia she just said that naturopaths are not a thing. They just don't exist. And so that's, obviously then she's looking outside of the country, which is one of the other kind of, I guess, benefits of going outside of the physician circle, is that you can more often do virtual consults. Not necessarily, you don't necessarily have to stay within your local area if that's something that is helpful.
Yeah, such a huge thing that so many newer patients are dealing with is that access to care, even here in the United States, because so few doctors can see patients outside of state
Yes.
lines because of government
Yes.
regulations and all of that fun stuff. Insurance plays a part. It's great that patients do have options, even if it's not, gold standard perfect. Some of our members in the CIRS group might have a GP that's willing to
That's the other thing.
prescribe
Yes,
cholestyramine or something, but
definitely.
they don't have the guidance of a true CIRS literate or mold literate person to guide them through the
Yes.
process of it beyond that. So to, play on whatever resources you have, create your team to
Yes.
kind of navigate all of the things and try to piece it together. It's not as simple and straightforward as just getting a doctor locally, but sometimes it's what you got to do. So I'm really glad that you exist and that these, services can be pieced together however they can to get people better.
Well, thank you for sharing all of that information. I love the fact that you focus so much on creating momentum so early on in the protocol. I think a lot of people become discouraged in that first step, getting out of exposure, because it can be so burdensome to so many
Yes.
people. And for myself, I know that when I was, finally prescribed binders and I went to the pharmacy and they weren't available that day, I had a emotional breakdown in the pharmacy. And
Yeah.
I think when you're so close to this thing that's finally going to get you well, you want to have a lot of early momentum. So I love that you focus
Yes.
on those things so early on in the protocol. While we have you, was there anything else you wanted to share in terms of tips for people that don't have access to CIRS provider in the US or in a country that makes treatment more difficult?
Nothing in terms of the actual treatment. I guess I would just to kind of build on what we were just talking about is, there are, it doesn't have to be me. There are people, if there are naturopaths and nutritionists all over the world. If you can't find one that resonates with you, or that that is, they don't have to be near you. There are ways around using a local practitioner. There are ways to get you the medications, and at least natural medications that you need. And there are also ways that we can work with, like you mentioned, Barbara, if you do have a GP that is open-minded enough to want to help, but doesn't really know what to do, there are ways that you can kind of build a team, and, and we can kind of liaise to that. That's actually a perfect situation, because then you've got someone that can guide, and someone that can prescribe, and bridge that, especially with the difference in medical systems too, or healthcare systems. It's very different, in the US with insurance than it is in Australia or the UK, where we don't have that system. So I can't guide. I have no idea how that works specifically. So it's great to have someone on the ground there if you do want access to the prescriptions. But if that's not possible, there are ways around that. There are many kind of online pharmacies that deliver globally. So there is a way around it. So, don't, I guess, give up hope if you can't find someone in your own state. Do kind of look outside of that and see if you can find somebody that's able to help you, from a different place, a different location.
And I feel like it's a good time to also plug the very first and upcoming first annual CIRS Summit that is coming up. And the reason that I'm plugging it now is that Dr. Berry was kind enough to be on the international panel. We had practitioners from Canada, the UK, Australia, and then one that handles also all international, but is based in the United
Yes.
States. And that was really
Yes.
such an informative conversation. So if you are an international patient, CIRS patient, I mean, the summit is going to be great for everyone. We have so many speakers: Dr. Shoemaker himself, Dr. Dorninger, Dr. McMahon, Dr. Peg DiTullio, so many people. So if you guys are interested in checking that out, the URL, JC, is that in case I butcher it?
It's the CIRSsummit.com.
You're like, it's really easy, Barbara. Why did you throw that over to me? There are two S's that might, and there is a but yes, thecirsummit.com. You can go there and register for that. It is free. It is the first week of December. So definitely keep an eye out for that. And yeah, more great information there. But obviously, I met Dr. Berry there on that panel, and I thought, oh my gosh, I
Yes.
can't wait to have her on the podcast. So I'm so glad you're
Thank
able to
you.
come do this with us.
Yeah, no problem. Me too.
Just thank you so much for being here today. We appreciate what you do for the CIRS community and what you do for CIRS patients everywhere. We can't thank you enough for your time. So if people want to work with you or they want to find out more about you, where can they find you?
Yeah, so my you can find me at Dr. Kate Health. That's DRKATE Health, all one word, .com. And yeah, you can find lots of kind of free goodies there with recipe ebooks. There's a symptom cluster analysis there and you'll get a response. Sometimes people find it a little bit confusing as to what symptom clusters mean. So if you're interested in doing that, that's Dr. Shoemaker's symptom cluster analysis, and you can schedule a free 15-minute call there as well, so we can have a chat if you want to have a quick chat about anything CIRS related.
Well, great. We'll have all the links in the show notes, of course.
Yeah, great.
And of course, for more love and support and info and resources, visit us over at theCIRSgroup.com.
We'll see you there.